Hi there, 2254, coming back to give part 2 of our legal lecture. And I want to pick back up on nursing standard of care, just reminding that we do have guidelines for our profession. Ethical or legal duties of a profession, in our case nursing, to exercise the level of care, diligence, and skill prescribed in the code of practice of his or her profession, or as other professionals in the same discipline would do in a same or similar circumstance. So when you hear me reference, and I reference this a lot, what any reasonable or prudent nurse would have done in a similar situation is how we know whether or not a nurse that has been named in a suit, how we know whether or not there was negligence involved is we examine other similar situations and what a reasonable and prudent nurse would have done in that same situation. And that's how we define if they're practicing within their scope of practice, their standard of care, and avoiding nursing negligence. So when it comes to the Nurse Practice Act, so you can go on ANA website, you can see what the standards for our profession are, and there are several of them. I've listed them here on 2 different slides, and I'm going to read through some of these. Just stop and listen to them and let this penetrate your mind a little bit. Many of them, as I've mentioned, are common sense. However, we need to have clear-cut written guidelines in which we can reference. We can reference these as nurses in our profession, but also the general public can reference these standards of care. So they know when a nurse, whether he or she is falling below the standard of care and could be possibly named in a nurse negligence medical malpractice case. So standard 1 is assessment. The registered nurse collects comprehensive data pertinent to the healthcare, consumer health, or the situation. Thorough assessment is standard 1. Standard 2, the diagnosis. The registered nurse analyzes the assessment data to determine the issues related to the diagnosis. We are not in the, as far as a bachelor's prepared nurse, we're not in the stage of making the diagnosis, but we are going to use our keen assessment skills from standard 1 to help identify, is this the correct interventions for that diagnosis? We're going to analyze the situation and say, does this make sense to me from my expertise as a nurse? Standard 3, outcome identification. Registered nurse will identify expected outcomes for a plan. So the whole care plan, that seems like a painful process. This is why. This is part standard 3 in our standard of professional nursing practice. Standard 4 is planning. The RN develops a plan of care and prescribes strategies and interventions to reach those outcomes. So not only do we focus, we're outcome driven. We want optimal outcomes for our patients. We're going to plan an appropriate roadmap to get there. Standard 5 is implementation. We don't only have it here and have a plan. We're going to actually put boots to the ground and make that happen through appropriate implementation of interventions. Standard 6 is evaluation. Any intervention we do, we want to most definitely evaluate the effectiveness of that plan to see if we need to modify, if the situation was rectified, but just the evaluation of that basic care plan. Standard 7, near and dear to my heart, I love, is ethics. The RN practices ethically, not most of the time, but consistently is ethically sound. Standard 8 is education. The RN not only attains the knowledge and the competencies, and then that is going to be reflected in his or her practice, but then also will maintain that competency through continuing education, hours of clinically at the bedside, set by the Board of Nursing. Remember, we have that governing body. Now we are a profession. When we are professional registered nurses, we have those guidelines set, and we will maintain that level of competency. Evidence-based practice and research is standard 9. The RN integrates evidence and research findings into practice. We don't do what we've always done. We don't want to get into a trench, into a rut, and just continue to do it. We know everything all around us is ever changing, especially in healthcare, be it technology, be it policies and procedures and the way we go about certain tasks. We want to always be thinking, is this the best way to do this? Not, is this my way? Is this the best way? As a patient advocate, is this the most effective way to help my patient reach the optimal outcomes identified in my plan of care for that patient? Standard 10, but back to standard 9, the research base. That's why it's so important that we have nurse researchers as well. We want our own nurses from our own profession contributing to that pool of research so that we can then apply that. And even in collaborative efforts, that we are contributing to that evidence-based practice, and then not only producing that research, but we want to take it and actually implement it into our plans of care. Standard 10, quality of practice. The RN contributes to quality nursing practice. If there's something that's not working, or something, if we're leaving in Foley's in too long and we're seeing an increase, a spike in UTIs, we need to do something about that. We're going to deliver quality nursing interventions. And when we evaluate that, if we don't see the results we want, we're going to back up, we're going to retrack, reevaluate, and then we're going to try again. And we're going to continue that cycle of evaluating so that we are bringing optimal quality of practice. Communication, the RN communicates effectively in a variety of formats and areas of practice, not only amongst us in our own profession as nurses. We want to communicate effectively therapeutically with patients. As a pediatric nurse, it's critical that I can go into a room with a newborn and connect with parents in the room that maybe have 6 kids, and maybe in the next room it's their first child and they're freaked out and stress level of 100, and I want to be able to communicate therapeutically in both of those situations. I'm going to come over into the next room and I may be with a teenager with an attitude that doesn't want to talk, and I need to be able to crack into that shell and be able to deliver quality communication. I need to be able to communicate effectively with a physician that I don't feel is prescribing adequate pain relief for a patient as I'm advocating for a patient. My communication of concerns, if there are things that I see on the unit that I think could be done better, I need to be a front runner in that, and I need to be able to communicate professionally if there's an area that I have concern with, or I need to also be able to take communication well, even if I view it as criticism, view it more as constructive feedback. But just that level of communication between you and your peers, you and your colleagues, you and your patients, their patient's family, other collaborative efforts with other members of the healthcare team. Communication is key in the standards of nursing practice for us as registered nurses. Collaboration, leadership. Let's go back. Standard 12, leadership. The RN demonstrates leadership in the professional practice. As nurses, we want to take lead roles. We want to have seats around the tables when decisions are made. We want to be showing leadership in the community by getting and serving in different organizations, on different boards. We want to have a voice at the table. So demonstrating that leadership, even if it's as a new grad on your unit, you want to speak up and have a voice. If there's opportunities to learn new skills, if there's opportunities to step up and take on a new task, being a shift manager, being then a manager on a unit, and then expounding on that, or in a professional organization, holding an office, demonstrating leadership, because as nurses we want to be on the front lines and have a voice at the big tables when decisions are made. Collaboration, again, collaborating well with realizing we are a team. Nurses don't have all the answers. Neither does any other member of the team of healthcare. But together, it is a beautiful thing. So when we work together and we collaborate, it's all in the interest of the optimal outcomes for that patient. Standard 14, professional practice evaluation. Registered nurse evaluates his or her own nursing practice in relationship to professional practice standards, guidelines, relevant statutes, rules, and regulations. This just means we're responsible as registered nurses for holding down the appropriate standard that we should have as a registered nurse. If changes are made, if changes are made regarding rules and regulations, if it's continuing education, whatever the case may be, we are staying up to that standard. And the way that we find this oftentimes are go to Nurses Day at the state capitol, start there, being involved in nursing organizations and know when changes are evolving and being part of that change. And owning the fact that we share a profession. You not only represent yourself as a nurse, but you represent our profession of nursing. So just being plugged into that is so important. Then also, sorry, I have a child over here. Also, we're looking at resource utilization. The RN utilizes appropriate resources to plan and provide nursing services that are safe and effective and financially reasonable. As an advocate, this is even an ethical issue. If you have a patient come in, maybe finances are an issue, maybe you find out that a patient is not filling a prescription, and then you find out it's because they don't have a vehicle, they don't have reliable transportation, and you think this is non-compliance and you're highly put out the fact that they're not being compliant. Maybe you should peel that back, take the judgment glasses off, and offer support. Tell me a little bit about this. What is it? And find out, is there a lack of education? Maybe they don't comprehend exactly the importance, or you find out that it's a lack of resources for transportation. Maybe it's the resources they are choosing to purchase food for the table rather than prescriptions for their condition. So help them with that. There are resources out there. If I know in another class I teach, we do a whole resource presentation on resources that are available. You need to put these in your tool belt so that you can then hand them out as resources, and be aware, be constantly aware. Even when you're going throughout your daily life, you'll hear of different resources available. Man, I need to tell my patients about that. That's amazing. There are a lot of great organizations out there that can support many conditions, be it acute, chronic, that can come alongside and help patients and strengthen family units to be able to provide that support again, so that we can help that patient obtain optimal outcomes. Then Standard 16, environmental health. The RN practices an environmentally safe and healthy manner. This goes everywhere from when you're working in the environment, you want to create a safe environment, knowing that you're leading by example. So things that you do, the patient will watch and they'll do as well as even for yourself. Many people will look to a healthcare professional, especially if we are the most trusted profession, are going to look to you to see, oh, that's a standard of different practices. And this is a no judgment zone of me. That's not the point of this, but there's certain things that if they see you doing, then they will assume, and well, if they do it, they're a nurse, that must be okay. Just keeping us safe and appropriate and exercising that healthy environment for yourself, as well as the environment that you work in. If you're in as a school nurse, you want to just demonstrate what you would like to see reflected in those students, and constantly giving that education, but not only giving information about what is safe and healthy and appropriate, but demonstrating that as well. So that is Standard 16. That lets you know, and you can again go on the website, go on ANA, explore OBN website, and know what's out there and what's expected of you, because this is the standard of care that you're going to be measured by. And when we're thinking of legality and we want to refrain from being named in a lawsuit, you want to make sure to avoid nursing negligence or medical malpractice that you're functioning within the scope of practice and the standard of nursing care, which is outlined in these 16 standards that we just went over. Code of ethics is also reflected in 6.4. So I'm going to just kind of skim this pretty quickly, but it's going to be echoed again in 6.4 when we actually hit ethics. Code of ethics is a philosophical idea of right or wrong. It's that struggle we have in our minds of what is what is right, what is wrong. Sometimes there are two rights or two wrongs, and you have to find the best or most appropriate in a certain circumstance. Define principal use of care. It's important for you to incorporate your own values and ethics into your practice, or be aware of those and know that they filter out and spill over into your profession. Your personal code of ethics can spill over into your professional code of ethics, and vice versa. Sometimes that's okay and acceptable, but you need to know that your ethics can be related into your morals. Those are kind of some gray areas. Some of that can almost put you into a mode where you could be a little judgmental or highly opinionated, and there's not a place for that in healthcare. So be aware of that. Again, I say take the judgment glasses off. Sometimes you have to take the personal code of ethics and put that aside. And that can be a very uncomfortable position to find yourself in, and maybe not the best place for you to practice nursing if you find yourself in that. If you do and you want to talk about that and kind of talk through that, reach out to me. I love to peel that back and have those conversations. And ask yourself, how do your ethics, values, and practice compare with established standards? When we read through the standards of care, did you find yourself saying, yeah, that makes sense? Okay, yeah, this all comes together. Or did you find one that maybe hits you a little bit off? You'd want to explore that because we are accountable for all of the standards we mentioned. Nurses practice in a variety of settings. That's the cool part, but that's also the complex part about the profession of nursing. We have to have standards of care, whether you are out in, there is so much, it's a growing population of nurses that are working out in the community. There are visits being made, home health, hospice. People are choosing to have care brought to them and less likely to go in and sometimes access that care. So in the hospital, it's a little bit more of a controlled environment. But as we take that outside of the walls of a hospital or clinic, it becomes a little bit harder to manage because there are so many settings. But nurses are, in general, wherever you're practicing, nurses are meant to protect, promote, and optimize patients' health. Protect, promote, and optimize patients' health, helping to reach optimal outcomes for your patient. Regardless of the setting, the illness, the injury, whatever the case may be, we're trying to protect, promote, and optimize our patient's health. Prevent illness or injury through education. Obviously, it's easier to prevent. It's better for the patient if you can prevent than to have to come on the backside and now we have to fix the problem. So if we can prevent the problem to begin with. So how do we do that? Is through proper education. And that's sometimes something that's a little we don't value quite to the extent of how important it is as nurses that we're educators. Whether you're in academia or not, if you are in a clinical setting or a hospital setting, when I have that patient, even if I know they may only be here for 2 days, we need to pump as much education and resources as we can for that patient. If I'm a school nurse, I know all the potential injuries that may come during the summer. Maybe I want to take that March and April, and I want to provide a lot of education, thinking I may prevent a drowning, I may prevent someone from being hit by a car, I may prevent someone from being left in a hot car, or someone being left, whatever, being around water and reaching for something, just different things that I can talk about and educate in a setting that's maybe not threatening, where I can avoid having to fast forward 2 months and now they're in the emergency room because they were riding their bike without a helmet and they rode right behind a car that was backing up, and now we have a catastrophic event on our hands. So prevention is key. Alleviate suffering through the diagnosis and treatment of human responses. Alleviate suffering, we're going to advocate for that patient. What that patient wants, we're going to empower them to have self-determination in their diagnosis. What makes it best for them? What's ideal for them? Whether I agree with it or not, I am going to help to alleviate any pain or suffering. Advocating for proper pain management when we talk about the double effect. What may seem as it would be too high of a dose, maybe in this case is acceptable. and the benefits will outweigh the risks. So that double effect. I'm going to advocate for that patient. That's the next one. Advocate for care of patients, and then duty owed. If I'm the nurse, you come on and I'm assigned to you for the next 12 hours, I'm going to give every bit I've got for that 12 hours to be the advocate, because I have a duty owed for you when you are accessing healthcare, and I am there granted the privilege and the right to serve as your nurse during that time. I'm going to advocate to the full extent to give you competent nursing care to the best of my ability, because that duty is owed to each citizen that walks through the door seeking health care. Professional responsibilities. We've kind of gone through this where it used to just be kind of caring and comfort measures to now we are a profession. We are registered nurses with the guidelines, and we have stepped it up a notch. So several notches, you can read through that slide. Basic terms in healthcare. This couples, legal and ethics couples together very well. So although we're going to hit ethics in 6.4, I'm just going to hit them very quickly here. We can revisit them again in 6.4. But if you have any questions, reach out. But some of these do cross over. Autonomy, commitment to include patients in the decision making. You don't need to tell them what they want. Let the patients speak for themselves. If they're not capable or able, let someone in the room, a caregiver, speak into their care. If there's not a caregiver then do what you would want if that was you in that situation, based on orders from the provider. Beneficence, taking positive actions to do good, to help that patient, to do good. If there's something that I know I could do, even if I am overworked and underpaid, understaffed, everything is in there. If I know I could make them more comfortable by turning them on their side, putting a pillow between their knees, giving them a pillow to hug. I know they like soft music. I'm going to get that turned on. I'm going to make sure they have pain medication 30 to 45 minutes ahead, because I know they're going to be going down the physical therapy, and I want to help promote health. I want to do good. I can foresee these things coming. And I probably wouldn't get docked by not doing those things, but it's that human art of caring that is beneficence, just doing good. Non-maleficence, you're going to avoid harm to a patient. This is something even as simple as you're walking along and you see a spill on the floor. That's a potential hazard that could potentially create harm, although you probably didn't spill it. It's important that we take those steps. If there's something in the room that I see as I'm coming in and I know I'm going to ambulate this patient, I want to clear things out. I want to pick things up. I want to do everything I can in the power to make sure that the patient, that I can avoid harm for that patient. Also, this would include taking a few extra minutes when you're discharging a patient to home, going through those things. Now that you're using when you came in before your stroke, you were ambulating independently. Now you're going home with maybe a walker or assisted device. Let's talk through some things. Do you have stairs at home? How do you access different things? How are your doorways? What types of things? Is your sidewalk smooth? Do you have cracks and crevices that may be a potential falling hazard? Avoiding harm, helping talk through some of those things for them. Justice, being fair, regardless of your economic status, regardless of your ethnic background, regardless of things that you're saying, alleged crime that you've been accused of, your non-compliance, whatever the case may be, there is justice for all and being fair to all patients. I'm not going to treat this child over here any different because I find out that their parent is the mayor, the governor, the whatever. I'm not going to treat them any different than I am this child over here where there are no caregivers and they're trying to figure out where the child would be placed, even though I think I could get away with a little less care here because I'm not being judged as harshly and critically and closely. If I am underneath the ethical principle of justice, I will treat these two pediatric clients the exact same way because it's justice for all. Fidelity, agreement to keep promises. If I tell you I'm going to be back and check on you in an hour, I'm going to be back to check on you you in an hour, or I'm going to buzz in and say, hey buddy, I am in here giving somebody a medication or starting an IV. I just wanted to let you know, I told you I'd be back, and I will. It's just going to take a few extra minutes. I'm going to go that extra step for fidelity to keep my promises. I'm not going to tell someone something that I don't know if I can keep. If they ask me, am I going to be fine? Am I going to get better? Am I going to die? Different things. That's going to be a skill you're going to work through on responses that you can say that still give hope, but where you're maintaining honesty and integrity with your patients, but keeping promises. Do what you say that you're going to do, and just be cognizant of that. Some legal terminology now: statutory laws, criminal laws, and common laws. Statutory laws are acts passed by elected officials. It can be at the state or federal level. Criminal laws, and then common laws are going to be, the difference is criminal laws have intent. They're usually premeditated, and there is no accident involved. So that's how you're going to be able to tell the difference with those. Again, go to the next slide. Criminal versus civil. Civil law can be something like a car rear ends another car. You can put, like, well, you shouldn't have had, maybe they had their phone up, maybe they weren't paying attention, it can be just a pure accident. Criminal is more the sake of, I stole something. If it's in a healthcare setting, I stole the medication. I signed off that I gave that to Miss Smith in room 307, and I took it and I put it right in my pocket, into my backpack, and walked out of the hospital with it. Not only did I probably did this yesterday, and I probably have done it for weeks, maybe months before that. So criminal is premeditated. Civil can come, there can be that gray area of, was it an accident, was it not? But that's how you can tell the difference. Nursing negligence can be criminal, civil, or both, depending on the action. If a patient falls out of bed, maybe I am reaching for the walker and have them sitting on the bed to kind of get their equilibrium back, get their balance, and I reach for the walker. When I do so, they fall out of bed. That's going to be a different case as if I steal something from a room when they're down in the OR for a procedure. So you can tell the difference. But nursing negligence, depending on the circumstances, can be falling under both. But know the difference between what would be a civil or a criminal, based on generally on intent. Okay. So nursing negligence is a civil tort. Anything that can land a nurse in court is a tort. There's a duty to perform in either unintentional or intentional harm. I have some examples of, I'd like you to, if you want to pause right here, I want to update some of these. These are good ones, historically good ones, so I kind of keep these on here. But if you stop and you pause right here and just look up, just do a quick Google search on legal ramifications, legal cases regarding nursing, and see some of the issues that are out there. It helps to kind of avoid the pitfalls of things that we can find ourselves in as we go through. So this is the baseline of legal content. Throughout the program, we're going to continue to build on this, and you're going to become more and more aware of a lot of the pitfalls that nurses are falling in, how to avoid those, and we'll expand on that in upcoming courses as we revisit. So elements of a tort are, there is a duty to perform. When you come in and you're assigned, and I hear, okay, now you're going to get room 307. They're coming up. They had an appendectomy. They're coming in. This is what they're here for. This is the plan of care. Now this is going to be your nurse. I'm going to be your nurse for the next 12 hours. Now I have the duty to perform. As a registered nurse, I have that duty for the next 12 hours. Failure to show proper care. If I breach that standard of care, and then if there's injury, must be proven that there is an injury that occurs, and then it must be linked. My breach in the standard of care, providing that care, caused that injury. So there must be, the causation was directly linked to the breach in the care that I provided. In other words, if I leave a patient the bed rail down and they write that down, that my nurse came in, she didn't put the bed rail up, and then they go down and they're discharged and they leave and they slip and fall getting in their car and they break their hip. They cannot in some way reference that back to blaming me for something that I did that was completely unrelated to that fall and breaking of that hip. So they're going to look for the duty to perform, there was a breach in the standard of care, there was an injury that occurred, and that there is a direct link between their injury and the breach in care. So know the elements of a tort. And statute of limitations, you're going to generally have up to 2 years. 2 years in order to file a lawsuit. In order to make a claim, you're going to have a 2-year window. Once it's out of that, then it's pretty much out of bounds. This is you if you have the offense that you're wanting to take out the lawsuit. Also, if it's something that you're concerned about, you know that once that 2 year passes, then you're going to be generally off the hook for that. So statute of limitations, you know, is generally going to be about 2 years. So statutory laws, know that nurse practice acts fall under the umbrella of statutory laws. Administrative agencies, you can kind of go through these quickly. For the sake of time, we had the other video when we're hitting an hour now. So I want to kind of wind this down, but administrative laws, composed of persons of qualifications and experience, implement particular legislation, create and enforce rules and regulations. This is going to be more in an institution. You're going to have administrative bodies that will enact certain laws that will be enforced. Standard of care, we've kind of went over this. Again, proof of negligence. So for a tort, the elements of a tort we know, which then would lead to the accusation of nursing negligence or medical malpractice, which can kind of be used interchangeably, but if it's specifically related to the nurse, it's nursing negligence. If it's related to the case, it's medical malpractice. But again, proof of nursing negligence, again, duty. The duty was owed to that patient. You did not carry out, you had a breach in your care, or you did not carry out, you omitted something, or there was just a general breach in the care. The patient was injured, and then that was directly caused by your breach in care. So I think that will get pretty much all you need, because some of this is kind of repeats. I say it a few different ways, but the things that I've highlighted for you is what you'll need to focus on. There's also some review questions on here, but we're going to come on, join, and collaborate. And then I'll kind of hit the parts that the need to know information. But the rest of the PowerPoint is going to be nice to know information. And again, I will highlight the areas to kind of focus on. This is kind of a broad area. I want you to know the concepts, but not only know those concepts, be able to recognize that in a patient case scenario. So we'll look at some of that as well. If you have any questions regarding legal or ethics, please reach out to me. I am more than happy to help to peel that back, and we can kind of discuss what things look like. But just know we will continue to build on this, because there's a lot of times questions come from students. What can I do to make sure that I stay out of be named in any legal cases, or the ramifications of that? I don't want any marks on my name. I don't want to get written up for anything that may have legal ramifications down the road. All of those things we will dive into as we continue to build on this throughout the program. But if there's anything of specific concern, or maybe you work now in healthcare and you want to explore some of that, I'm more than happy to do that. So just reach out to me. Look forward to meeting you in Collaborate in the next hour. Take care.